Hello my dear friends, today I'd like to offer my top tips of how you can get very clear corneas on the very first post-operative day even when you're handling very hard cataract by phacoemulsification. Now let me highlight these facts. In the following case, the patient had a grade 4 nucleosclerotic cataract. It is my practice that whenever I do not see a good red glow, I always stain the anterior capsule because it will help and assist in capsular rhexis, and also later on in the procedure helps me to understand where the edge of the capsule lies in order to safely manage nucleus emulsification. This is not an intumescent cataract, it is a white cataract with almost a shrunken anterior capsule. Managed to get a pretty large capsular rhexis size close to 5.75. The amount of cortical cleavage hydrodissection required is very minimal. In fact, you can simply rotate this nucleus even without much of cortical cleavage hydrodissection. Use a dispersive viscoelastic that will adequately coat the corneal endothelium before you start. The phaco tip has been exposed to almost 1.5 to 1.75 millimeters. This is because you need to drive the tip into the nucleus beyond the midpoint of the nucleus. It is only then that you will get a very good hole that will enable you to chop this very hard cataract. The first tip is that you work by creating multiple small fragments. The number of fragments we normally do is 4, but we need to work with creating at least 6 to 8 small fragments. The advantage of creating multiple fragments are two. One is the fragment creation will always occur within the capsular bag, and therefore you're well away from the endothelium. And second, the amount of phaco energy that is utilized is just a short burst of phaco to drive the phaco tip into the nucleus substance, and then you're using just mechanical forces, which means that you're basically cutting down on the phaco energy. This is going to be more friendly to the endothelium. Don't try to mobilize the pieces initially. You don't want fragments in the anterior chamber till you have created all the fragments. The tip number 2 is, while creating the fragments, make sure that you take your time to bury the phaco tip into the substance of the nucleus. You create the crack and then go deep down into the crack and make sure that you get a good lateral separation that will split the posterior plate as well. When you see that you have got a smaller size fragment, then you emulsify it. Tip number 3 is the plane of emulsification. At any point in time, even when I'm mobilizing the nuclear fragments and emulsifying it, this is being done at the level of the pupillary plane or probably in the supracapsular plane. I am not bringing this piece into the anterior chamber above the iris plane. Something like a best fit curve where at least 50% of this nuclear substance is behind the pupillary area or dangling within the capsular bag, and only a small fraction of this fragment is actually above the pupillary area in the anterior chamber. Giving phacoemulsification in this controlled manner, you will create lesser amount of damage to the corneal endothelium. The fourth tip is that you set the phaco power in the panel or non-linear mode and not in the linear mode. If you're working with either the micropulse mode or if you're working with the pulse mode, because you're sure that at the foot pedal position 3 that the full power will get delivered. This will enable you to work with the lower power settings than you would need to resort to if you were to set it in the linear or non-panel mode.
This has been clearly explained in the landmark study by Dr. Jamie Zacharias, who said that the deleterious effects of cavitation at the normal atmospheric pressures is more when you use higher phaco power of 50% or more. These deleterious effects can cause heating up of the incision and cause wound burns and also damage to the corneal endothelium. By reducing the phaco power or keeping it to 50% or less, which is what I normally do even in hard cataracts, but by using a panel or a non-linear mode or by using a multiburst mode of phaco delivery, you can make sure that this full power is delivered the minute you go into foot pedal position 3. So what you see now is that I'm working on the multiburst mode. The power setting in this particular case, believe it or not, is just 40% in the Stellaris machine. The burst duration is 30 milliseconds and the duty cycle is 75%. This ensures that in foot pedal position 3 that I directly go into maximum power setting of 40%, and as I depress the foot pedal, these bursts come closer and closer together. This helps in a more efficient phacoemulsification. To sum up, I would say that there are 4 important rules in trying to get clear corneas when you're dealing with a hard cataract. The first is you try to break down the nucleus via direct chop maneuver into as many small pieces as possible. Now, breaking down the nucleus into small fragments would mean that you're performing these maneuvers within the capsular bag, and therefore you stay well clear of the anterior chamber and far away from the endothelium, which is protective. The second important point is to make sure that the cracks are properly separated through and throughout their entire extent, including at the posterior base plate. The third important point is that you have to emulsify these pieces at the level of the supracapsular or the pupillary plane. Mobilize only one of the small pieces at a time, and therefore you will get much less damage to the corneal endothelium. Finally, the fourth important point is that you set the phaco power around 50% or slightly lower, and you keep it in the panel mode or the non-linear mode so that you're sure that the minute you go into foot pedal position 3, the full maximum phaco power setting will get delivered. This is the way the patient appeared on the first post-operative day, less than 24 hours after the cataract surgery. He had crystal clear cornea and anterior chamber was free from significant inflammation with a nice round pupil. Thank you for your attention.